My name is Darren Kies. I'm an interventional radiologist. I'm the chief of interventional radiology for a private practice group called Piedmont South Imaging, and we provide services to Piedmont Fayette Hospital and Piedmont Noonan Hospital in the south and southwest metropolitan area of Atlanta. Kyphoplasty is the name of a procedure that's used to treat fractures in the spine. In a broader sense, a kyphoplasty can be referred to as vertebral augmentation. And it is one of the procedures that can be performed for patients with fractures in the spine. The main purpose of a kyphoplasty is pain control. Fractures in the spine can be very, very painful. Typically, what happens is with a fracture is that the bone is every time the patient moves around, the bone kind of rubs up against itself, and along that fracture pain, it stimulates, intense pain signal. In patients, it can be quite debilitating. Some patients can't get out of bed. So what a kyphoplasty aims to do is to stabilize that fracture. The kyphoplasty differs from other types of vertebral augmentation in that it also is aimed to help restore some of the height that is lost when a vertebral body collapses. So you use special balloons that are placed into the vertebral body to kind of lift up that fracture and create space, and then cement is placed into the vertebral body in order to help stabilize that fracture. Procedure is done typically on an outpatient basis, but it can also be performed in the hospital if the patient is debilitated and can't be at home. These procedures are generally performed with general anesthesia, so the patients are put to sleep completely and don't remember anything about the procedure. These procedures are performed by interventional radiologists. Sometimes they're performed by orthopedic surgeons, and there are some neurosurgeons who do kyphoplasty and vertebral augmentation as well. The way in which the procedure is done is real-time X-ray, which is something called fluoroscopy, is utilized to help guide a needle through the back into the fractured bone through these small portions of the bone called the pedicles. That way, all the important structures in your spine, including your spinal cord and many of the different blood vessels, can be completely avoided. Once these needles are in place, the balloons can go through the needles to help restore height to the vertebral body. And then a special type of cement, a special type of bone cement is then placed through the needles directly into the vertebral body. And this is done under direct real-time X-ray visualization to make sure the cement deposits in the vertebral body as expected. During a vertebral augmentation procedure like kyphoplasty, oftentimes a biopsy is performed. In patients with cancer, unfortunately, sometimes their vertebral body fractures are due to a metastatic deposit within the bone. So this procedure can also help diagnose metastatic cancer. So that's one type of patient who should have this procedure done. Oftentimes, a vertebral augmentation procedure, especially when it's performed on a patient with cancer, can also be augmented with different types of techniques to help further control the tumor at that site. One of the techniques that's utilized is called radiofrequency ablation. So prior to inflating the balloons, special probes are placed through these needles into the bone, and radiofrequency energy is used to create heat, which will then kill that tumor deposit within the vertebral body. So, who should get by a kyphoplasty? Anyone with a vertebral body fracture that is having pain that is not controlled by the standard of care, which would be really just medical management with opioids. Unfortunately, not many patients often are told about kyphoplasty as an option, but it's an excellent option for pain control and can certainly help patients either completely eliminate or reduce their need for opioids, and it certainly speeds up the healing of the fractures. A kyphoplasty is performed by placing these specialized needles directly through the skin into the vertebral body. The needles are advanced through a very specific part of your vertebral body called the pedicle. Now, the pedicle is a very thin part of bone located on either side of your spinal cord that connects the main body of the vertebrae to the elements on the backside of the vertebrae. And the needle is directed through these pedicles in order to avoid damaging important structures that are in your spine, including your spinal cord, the nerves that come in and out of the spinal canal, and all the blood vessels in that region as well. A provider will order a PET-CT in order to determine if a nodule needs to be biopsied. A PET-CT stands for positron emission tomography and computed tomography. It's a specialized medical study that not only provides detailed anatomical images of your body, but it also provides images about the metabolic activity of portions of your body by injecting a radiopharmaceutical, which is basically a small little radioactive particle linked to a glucose molecule into your body to determine which components of the body are the most metabolically active. Meaning, for example, something like your brain is incredibly metabolically active, and it's going to look very bright on a PET-CT. Something like your heart is very metabolically active because it's beating all the time, and it will look very bright on a PET-CT. The fat beneath your skin is not metabolically active, and it won't look bright on a PET-CT. Tumors are very metabolically active structures. So if a lung nodule is due to a malignancy or to a tumor, it typically will look bright on a PET scan. So sometimes the need to biopsy a lung nodule can be determined using this type of test.